Hi guys, thank you for watching. My name is Alana Branton. So for my presentation, I'm going to elaborate a bit on the content from week 5 on mental health laws. In lecture, we discussed the criteria for legally classifying mental illnesses, as well as treatment orders for individuals with mental illness who may have got into some legal trouble. But today, I'm going to be talking about the rights of individuals who suffer mental illness in the workforce. As we know, there's a ton of stigma surrounding mental illnesses, and that is very evident for employees with mental illness who are often stereotyped as incapable of working. There has been great strides made in efforts to try and decrease the stigma and better understand mental illness and how common it really is. However, discrimination does still occur. I chose this topic because I personally have been affected by mental illness and feel passionate about this topic and trying to eliminate the stigma to allow patients to receive better care and be seen as capable and equal. As we learned in mental health law readings, around the 1960s, there was a huge change in advancement for patients with mental health problems due to the deinstitutionalized movement, with therapeutic drugs allowing a vast amount of patients to leave psychiatric facilities and join into a positive community setting. So the problem there as well is that a lot of people see people who have been in a psychiatric facility as crazy people or people who are not capable of working. However, people who have maybe anxiety disorders or depression, the accommodations that need to be made for them in the workforce usually is pretty minor, and some of these disorders may actually be caused by their work environment. So, under the Human Rights Code, persons with mental disability have the right to be appropriately accommodated in the workplace. So, a case I wanted to talk about today surrounding these issues is Lane versus ADGA Group Consultants, Inc. So I'll give you guys a summary of the case. So Mr. Lane was hired by ADH Group Consultants, Inc. as a quality assurance analyst. A few days after starting his position, Mr. Lane informed his supervisor about his illness. So he had bipolar disorder and required some accommodations. The accommodations that he needed were fairly basic. He asked that if he were to show signs of a manic episode, that his wife be contacted. A few days after informing his supervisors about this, Mr. Lane was terminated from his position. ADGA Group did not address any of his needs, they did not seek any legal advice, and they did not even get any more information regarding his accommodations. So ADGA had breached the procedural duty to accommodate. Mr. Lane ended up being compensated, and ADGA is currently appealing the decision. So in this case, the accommodations requested were within reason. However, there are limits to accommodations in the workplace. So accommodations must not undo hardship. So by that, it means there's 3 criteria to not undo hardship. So that involves cost, availability of funding, and health and safety requirements. And this is under the Ontario Human Rights Code. So the Ontario Human Rights Commission has guidelines for the duty to accommodate, but they are not enforced by law. However, many guidelines do fall under human rights, so they kind of do go hand in hand. So referring back to that case, first of all, they did not even look into what would be needed to assist Mr. Lane. They sort of just dismissed his request. There was no undue hardships in his request. No cost would be involved for supervisors to keep an eye out for signs of mania, nor would there really be a cost for them to contact his wife. Any potential health and safety risks caused by Mr. Lane's mania would have been avoided if his accommodations were being met. So clearly no undue hardship would be caused here. Mr. Lane was simply terminated based on discrimination of his illness. So it is clear that this does happen regularly still today, even with these regulations in place. All employees, including those with mental illness, are entitled to dignity, respect, and proper treatment under the human rights laws. With accommodation, people with mental illness and other disabilities can work productively and be valuable members of a work team. So, my discussion questions for you guys. So the first one that I posted was, employers in Canada are not only faced with the legal duty to maintain a physically safe work environment, but a psychologically safe environment as well. Do you think that this new balance will encourage an overall more successful work environment? What are some pros and cons of increasing awareness of regulation in regards to mental health practices and accommodations in the workforce? And my second question is, it is believed that when mental health problems are effectively dealt with, performance and productivity increases and benefits both the employee and employers. Do you think that this is the case? Does supposed productivity outweigh cost and effort for accommodation of workers? So it does take a little bit of extra effort for employers to make these accommodations. So I'm kind of asking you guys if you think that it's worth it, because usually they are minor accommodations due to the undue hardship regulations. So in my personal opinion, I think it is worth it, and it treats everyone as equal and makes for a better work environment as a whole. So thank you guys for watching, and take care.